Hello, and welcome to Psych for Sanity. I'm one of your co hosts, Dr. Tara McKelvey Parker. I specialize in assessing and treating complex trauma and attachment wounds from childhood.
And I'm Dr. Brendel Doss. I'm a licensed clinical psychologist specializing in assessment, geriatric psychology, geriatric. What is wrong with me? Geriatric
Keep
psychology.
adding specialties. That's what's wrong with you.
Maybe that's the problem.
You do too much.
I do too much. No, geriatric psychology, child assessment and treatment, as well as forensic psychology. And I have this thing where when I hear a sound or a noise somewhere, I immediately look at the clock and note the time. So that way, when the police ask me, what time did you hear that? I can say 7:38.
Like you do this like often, like a compulsion.
All the time. Not, hey.
I'm just saying.
Don't
'cause
throw around the
I
C
do
word.
that too,
Do you really?
but not like it sounds like you do it.
I
Like,
do it out of habit.
religiously. Like I do
Man.
it sometimes when the noise is like extra
Yeah.
strange.
I do it like 90% of the time.
That sounds like a compulsion.
Jeez. I feel like we're pathologizing something that's maybe just another quirk.
Yeah, another quirk, maybe because you're scared, you know. check the
No, I'm not
time.
scared. I'm just trying to be an upstanding citizen.
Oh,
You
I
want
see.
me to know what
I
time it is
see.
so I can tell the police when it happened.
You want to be an upstanding citizen, I see.
Right.
Likely excuse. Well,
They never know on Law and Order. They never know when time it was. Like, oh, I don't know, like 12:30.
I mean, it is true. I do feel like I do that, like not as often as you, but mostly because I watch, and listen to true crime.
Right.
And you don't want to be that person who can't tell the police like the time that you heard the weird noise.
Yes,
Yeah.
exactly. You
Yeah,
want to be
I
able to
get it.
say confidently, it was 7:38, officer.
Yes. Exactly. But yeah, I feel like 90% is a lot. Like I don't necessarily feel like there are that many weird noises. Like to each their own.
Touche.
Touche. Well, I think I've mentioned on this podcast I like to sing
You do.
and have talked about singing in karaoke. But my funnish fact is that I performed at Johnny High when I was a teenager.
Tell people what Johnny High is, because I don't
Yeah.
think that
Yeah.
everyone knows.
Sadly, it doesn't exist anymore.
Aw.
But it's the country music venue where Leanne Rimes got her start.
Cool.
Like it's like this big play, like theater. You have to audition.
So you can't just go there and like sign up.
You can't just go there and sign up. You have to audition. You have to
Wow.
be selected for one of their shows, and they had shows every weekend. So they held
awesome.
auditions every week. And I sang "Hopelessly Devoted to You."
Patsy Cline.
Yes,
Classic.
original. Yes, Olivia Newton-John was the version I sang from
Ah.
Greece. But yeah,
I
was,
love
like,
that.
super super fun.
I did
and-
not know that about you until
Yeah.
today.
Yeah, well, funnish fact.
It is funnish and cool.
Thank you.
Your facts are a lot cooler than mine, and mine are
I-
concerning.
I actually was thinking that your fun facts are way cooler than mine,
Really?
and that mine are so boring.
You're not just saying that.
No,
That's sweet of you.
no, you're actually a weirdo. So most of your fun
But in-
facts are about like they're strange,
but in a good way.
in a good way.
Okay.
Yeah, maybe mine are more prototypically cool. but very bad.
That's all. That's
Based-
exactly what a cool person would say. Like literally. Yours are like classically nerdy, but mine are like traditionally nerdy. Jeez.
Well, okay, so to kind of refocus because we could probably like tease each other forever about
We
this.
could. We do tease each other. Yeah.
I was thinking recently that on this podcast we've
Mhm.
spoken, quite a bit about therapy and assessment
A lot of
and
topics.
like trauma, like a bunch of things.
Right.
But we haven't really talked about how to pick a therapist. That might be important as we
Yikes,
start
yes.
talking about things that
Whoops.
are hard for people or challenging or getting their minds thinking they may want to go to therapy.
Right, and that can be a daunting thing.
Yeah.
To find a therapist for sure. So
I do think it's so daunting. There's a lot of steps
so many steps. It feels like.
to being able to find a good fit. So I was, keeping that in mind,
Mm-hmm.
how daunting, overwhelming it can be and multi-fast steps.
Right.
Like where should people start, do you think?
Well, I think a good place for people to start is if you have health insurance. You can contact your health insurance company, and you can get a list of people that are on your panel as a provider.
Mm-hmm.
And I think that's a good way to do it. But the challenge a lot of times is, and this is what people who have come to me have said is like, oh, that person's not accepting. Like, you have a list of 10 people. Well, maybe only like 5 of them are accepting new patients.
Yeah.
And then of the 5, maybe your time slots that you are free only work with 2 of them. So it can be kind of limiting.
Yeah.
Other
For
ways
sure.
to find a therapist could be through Psychology Today.
Yeah.
There's a ton of different services now. Therapy Den, Therapy Tribe,
Oh, I haven't even heard of.
Headway.
Oh, yeah, a headway I've heard of, but not the heard of the others.
Yeah, and they're all different kind of basically like mini, I guess mini search engines is a way, or mini directories.
Yeah.
Sometimes you as a therapist have to participate and pay to be listed. Other times you don't.
Mm-hmm.
But it kind of breaks it down by training and specialty, and that's one thing I
You
think.
can filter by those things.
Right.
if you
One thing
have
we
a
haven't
certain
actually talked about either is it's very overwhelming, and when you're not in the world of mental health, it can be confusing. A lot of times people call me and they'll say, "You're a psychiatrist," and I say, "No, I am not. I'm a psychologist," and people don't understand necessarily the difference.
Mhm.
Really simply put, psychologists cannot prescribe medication. We do not go to medical school,
Mhm.
and we generally participate in some form of talk therapy or some variant
Yeah.
of that.
And we know about medications,
We're
but we
right. We cannot prescribe.
can't prescribe.
There are some states that do some limited non-medical school prescription privileges, and that's coming, and that could be a future episode. But that's not.
Oh,
Yeah,
I think I've heard. Okay, that sounds familiar,
yeah.
but I don't know
But
much
that's
about
not
that.
that's not the current landscape today.
Yeah.
Psychiatrists. Back in the day, psychiatrists did not only talk therapy or analysis and medication. Generally speaking, not all of them, but most psychiatrists are just medication providers. They don't necessarily do in-depth talking
Mhm.
about your thoughts and feelings and challenges.
Mhm.
Some do still.
Definitely, and I know several
Right.
who still really practice more psychoanalytically,
Right.
talk therapy and prescribe
Right.
medication. But I would say you're probably correct that
Yeah.
it's not the norm.
It's not the norm these
Yeah.
days. And so between those two, there's other specialties. So a psychologist can call themselves a therapist, but a master's level clinician cannot call themselves a psychologist.
Yeah, I guess I never thought about that.
Basically, a psychologist is someone that has achieved a doctoral level training, and doctoral meaning the highest level of training that you can get, either a doctorate in philosophy or a doctorate in psychology.
Mhm.
Basically, we went to school for very, very long, too
Mhm.
long.
Mhm.
And master's level clinicians have a graduate degree, but it's a master's level. So it could be
Mhm.
a master's in education, a master of arts, a master of science.
Mhm.
And this is another confusing thing that adds even more confusion.
There's
For
lots
the-
of confusion.
Even
It's
more than that.
challenging.
After the doctoral versus master's level conversation, there's different licenses, and a license is different than a degree. If you have earned a degree in psychology, you can call yourself a doctor, but unless you pass licensure tests, you can't call yourself whatever license.
Yeah, I don't think I've ever thought about any of this, but it's true. And
It's so true.
thankfully, like, yeah, hope our patients are gonna have to be thinking about all
No,
of this
but I
stuff
think the more they
necessarily,
know, the
but
more they can be aware.
yeah, the more they know, the more they can be aware of
Right.
like, what that means. in
Essentially,
training.
if you want someone that's really, really had more training, you want to look for someone that has doctoral level training, is the way to think of it, because they've had more clinical in the school experience, right?
Yeah, sure. I would say at the beginning level, I feel like I feel like there are master's level
Oh my
clinicians
gosh,
who have a lot of
absolutely.
training.
So many
They've been
amazing
in the
ones.
field for a long time, but starting out, yeah, like if you're wanting maybe a particular specialty where
Right.
there's been more training in that area, like at the doctoral level,
Right.
yeah,
Yeah.
yeah.
And so, amongst the different types of licenses, and they also change the names of these types of licenses versus different states. So we're in Texas, and so we have licensed professional counselors, LPCs. We also have LCSW, which is licensed clinical social worker. Had to think about that for a minute.
Yeah.
And so those are all individuals that you might come in contact with that do talk therapy.
Therapy.
Yeah.
Yeah, and just their training was a bit different in that, I suppose, and that's why they got a particular license.
Training is different for each
Yeah.
one of those, for
Yeah,
sure.
yeah. Yeah, so it gets really, really nuanced, I think.
Right.
So it's good to be aware of level of
Right.
training and specialty and license.
Right.
And also, yeah, looking on some of these search engines to be able to find someone who meets your criteria, like based
Right.
on what insurance you have or what gender you're looking for or what specialty.
Well, also, like,
or,
can you help people maybe understand, like, for different symptom experiences, there are different types of modalities, or basically
Yeah.
types of treatment
Yeah.
that each
Mhm.
clinician employs. So, for example, if I, have a single incident trauma,
Mhm.
what would be a recommended type of therapy for that?
Yeah, I think that then it gets even a little bit more nuanced because you want to think about therapy modality and types of intervention when
Right.
you are searching. Right. And you would kind of pick, I think, based on your goals for therapy,
Right.
like what your concern symptoms are, and
Hmm.
also um, like where you are in your healing. I think so. For
Right.
a single incident trauma, maybe something like EMDR might
Sure.
might or could be helpful. Um, I don't even remember what it stands for. What is
I'm EMDR,
eye movement
desensitization
I should
reprocessing
know that
therapy.
because I have that training, but it is a hard one to remember. It's a
Yeah.
more trauma specific treatment.
Right.
So I like to think about, there's the more cognitive
Hmm.
behavioral approaches like cognitive behavioral therapy, acceptance and commitment therapy is more focused on values. That's probably a very narrow way of defining ACT therapy, acceptance and commitment. But I think about values. There's dialectical behavioral therapy, which
DBT.
is skills based DBT. I feel like that those kinds of treatments tend to be a bit more short term and focused on changing thought patterns or learning skills for emotion regulation
Hmm.
or really defining your values and living according to your values, I think is a big
Right.
one for ACT. Um, and so, like, if you have, distorted thinking, for instance, if you have like a generalized anxiety disorder and you notice that you have a lot of distorted thinking about, the future, catastrophic thinking, or whatever, and it's causing anxiety, or people are always looking at me or judging me, and it's you may do like a cognitive behavioral therapy to focus
Right.
on changing some of those thought
Okay.
patterns to reduce some of the anxiety.
Right.
Um, and then there's like more psychoanalytic or attachment focused, relational, or another term might be psychodynamic. They're all in that sort of ballpark
Okay.
of really examining childhood and relationships with caregivers and like, family system stuff and how that impacts your mood,
Yeah.
your behavior, your relationships, the way you have learned to cope with your feelings. And that's sort of where, my bread and where I kind of sit. Um, but
Sure.
I tie in a lot of CBT, DBT, stuff into my work too,
Right.
because it serves a purpose.
You meet the patient where they are.
Yeah, you meet the patient where they are. And then there are some more trauma specific, like really interesting treatments, like EMDR, like I mentioned, internal family systems,
IFS. Hmm.
IFS, somatic experiencing,
Hmm.
where you're really tapping into your body and what you're feeling. Internal family systems is this idea that we all have like if we had adverse childhood experiences, we're all made up of parts.
Yes.
They all have a different voice and they all serve a different role and they're all speaking to one another. And it's hard to access like your wise self in the face of some of these parts that want to take over. It's all super interesting. But like, I think you really have to think about, again, your goals, what you're sort of hoping to get out of therapy and where
Yeah.
you are. Like someone with complex PTSD or complex trauma, they're going to need like actually all of these
Sure.
interventions, I think, at like
Intervals.
certain time frames. So if you're like really beginning in your trauma treatment, I would not say go do EMDR, or or if you're going to do internal family
Yeah.
systems, maybe have an adjunct sort of talk,
Right.
like
Because it could be
home-based
overwhelming.
therapist. Yes, yes. And parts work is really sort of, in my opinion, targeted. And there's so much complexity with the complex trauma, but like I a lot of times recommended like a cognitive work like
Hmm.
CBT and DBT. All that stuff is so important for someone
Critical.
starting out in their sort of complex trauma treatment
Yeah.
journey. So that's a lot. Does that make sense?
It does. And I think, for me, the tie in is really just that there's a lot of options. And it's okay when you call a therapist to not remember all this. It's okay to ask questions.
And to, I think, ask, like, really
Yeah.
interview your therapist. Like,
Well,
you know,
yeah.
like, Like, don't be afraid to do some research about some of this stuff and say, like, how do you treat trauma?
Right.
Right? Like I've had people ask me that, and then I can talk about how I treat trauma, and it is a good fit for some and not for others.
Right.
Or if I'm hearing, during the first session or on the phone when I'm meeting with a patient, if I'm hearing that they'd be a better fit for a different kind of therapy or they need to start in a different place, then
Sure.
I would absolutely give them that information.
Right. Can I say something controversial?
Always, yes. Well,
So,
what are you about to say?
so for me, when it comes to like finding a therapist,
Mm-hmm.
as a therapist, as a psychologist, I am 100% okay being ghosted by patients after a session.
Mm-hmm.
I'm 100% okay with you not picking me. Not because I don't want to help, it's because I want to help, and that I don't believe every therapist should be able to see every type of patient. I think lived experience is important. I think, type of treatment, a type of training is important. And I want to be the right shoe for the right foot. Generally speaking, I know it's a silly analogy, but when you walk into a shoe store,
Mm-hmm.
sometimes you can try on the first pair of shoes and you buy it. But even those that are like, oh, I love this pair of shoes, it's still okay to try on the other shoes. It's totally okay. I know I said it was controversial, but I know some therapists are like, get really offended or like take it real personal when someone
Yeah.
doesn't come back. And
Yeah, certainly. Yes, I've
if
met folks who
if
who
I'm
feel
not, if
that
they're
way.
not comfortable with me and they don't feel
Hmm.
secure and they don't feel open and then over time confident, then it's not gonna help.
Yeah, I
And
agree.
I'm not in the business of not helping.
I agree. I want to try to point people to the most helpful treatment. Like, I want
Yes.
people to feel safe and comfortable. And if they don't, then it's not the right vibe. It's not the right fit.
No,
And that's totally fine.
it's not going to promote recovery. And the
Yeah.
whole point of going to therapy is, in my opinion, to treat a need or treat an issue. There are types of therapies, like you mentioned, that are more like long term, like psychoanalytic, that are more deep diving, and
Hmm.
that's fine.
Hmm.
Most folks, generally speaking, don't seek those out automatically.
Yeah,
Automatically
I
on the
think,
first go of therapy.
yeah, that's probably true. Yeah. I guess I don't know people's process for picking, but
Yeah,
yeah, I suppose not.
I think they
Yeah.
just want to feel better.
Yeah.
I think they just want help.
Think some people do. I do have quite a few. I feel like it is a little bit more common for people to come in with like I've had a lot more recently with like specific questions for me.
I love that.
It is really like, how do you treat trauma or what is your theoretical orientation or
Yes.
I've had patients more recently say things like I'd like to, schedule an initial interview to see if we're a good fit. And I'm like, great. And maybe this is because like therapy is becoming somewhat more of the norm. Like people are like educating themselves
Maybe.
about how to
Yeah.
do this, but um it has been surprising and like interesting and great because I do think again, like what you're saying, feeling good and really window shopping, shoe
Window shopping.
shopping
Yeah.
for a therapist is totally healthy and good and helpful.
Absolutely. So
Um
critical, I think.
and just knowing a little bit about what your concerns are, your symptoms are, your goals are for
Hmm.
treatment. And even if you don't remember all of these modalities and
Yeah.
things we're talking about, just being able to say all of that and feeling like the person you're reaching out to has got a clear plan for
Yes.
how they're going to treat you.
I
And
have had people reach out and say, "Are you comfortable or confident in treating this?"
mhm,
And I'm personally very, I think, secure in my professional identity. Where if I'm not confident or comfortable,
yes,
I'm going to say that.
yes,
And if there's a
yeah,
better person out there, I want you to get help. You
yeah,
know?
exactly. Yeah, exactly.
Yeah.
And so, okay. Well, yeah, so I think that's like the basics
I think
about
that's
how
a
to
very
pick
strong
someone.
foundation for sure.
Um, and of course there are other like concerns, but um yeah, I think that's the basic and hopefully that makes it a little bit easier when you're thinking about some of these
Less
topics that
overwhelming.
we're throwing out there that may be hard or triggering or just get you
Yeah.
thinking about stuff and you're like,
Yeah.
"Yeah, I want to do that therapy thing." That's how you would do it.
And I hope that like this conversation for those either watching or listening, like I hope that it maybe makes you feel more confident
Hmm.
because I know it's so uncomfortable to call someone or even email someone and say, "Hey, I have this concern or problem. Can
It's
you help?" That is
vulnerable.
It's vulnerable.
It's vulnerable.
And like you should be met with grace, respect, and support. And even if that therapist isn't the right fit, you should still get those things, in my opinion,
Yeah.
from people responding to you.
Mm-hmm.
And don't be discouraged. I think it's so I always try to return all my phone calls. I'm not perfect at all, but I always try to return all my phone calls, even if I'm full and don't have any open slots, because it's really disheartening to call someone and never hear back.
It is. That's part
You
of
know,
the issue. 'Cause
as a
people
patient
are
or
so
client.
busy and overworked and can't always. Yeah, and yeah, I'm kind of bad at sometimes neglecting phone calls,
Well,
but it
but
it
it's
is really important.
but what I try to do is when I call them back, if I don't have an open spot, if I don't have a place to put them, or I'm not the right fit for whatever reason,
Mm-hmm.
I always try to give them a name and a number of a
Mm-hmm.
place that I know A is taking new patients, B will take their insurance if they want to use that,
Mm-hmm.
and C is within their same like region, time zone, whatever.
Mm-hmm.
Because again, I just really feel it's really important to me that people get help.
Yeah,
You know?
absolutely. Try to be as
So
helpful as we can.
yeah. What do you need from today? What are you taking away, do you think?
Oh gosh, I don't know. I think going over all of the details involved,
Yeah.
I feel like a little bit like, holy moly, there is a lot to consider. Um,
Yeah.
and so I think I'm feeling, and I have a therapist. I've been in this position, but I
Sure.
just am feeling more empathy, yeah, for all of us folks who are just trying to get help and
Right.
trying to just find someone to heal and move forward. It's just really, it can just be hard.
It can be discouraging.
Yeah.
I think for me, what I'm taking away is I'm feeling more emboldened.
Oh, good. I'm glad
To-
we're
to-
totally on the opposite sides of that same coin.
Look at you and me, yin and
This
yang
is our
over here.
personalities.
This is
I'm like,
absolutely
I'm in
our
despair.
relational dynamic. You're
You're like,
discouraged, and I'm like,
I
yes,
know what to
let's
do.
help more people. No, no, but seriously, I do feel like the work we do is critical, and I feel like that, helping connect people to resources. If I'm not the resource, it's just a really strong and helpful reminder to keep doing that work,
Mhm.
no matter what type of shoe I am.
Yeah. Yes. No matter. We are all different shoes.
We are all different shoes.
What kind of shoe would you be? I'm asking the audience.
I know, I can
We
tell.
won't talk about that together, but I think now I'm interested. So,
You want to know what kind of therapist they would be?
what kind of shoe? A high heel?
Oh,
A Converse?
okay, I was confused.
That's actually where my brain went. It is literally doesn't matter right now.
Shoes. Well, if in the comments anything has stimulated you to reach out to us and respond back, like what challenges have you encountered when you're looking for a clinician?
Yeah.
What do you wish clinicians knew to help you better when you call on the phone? That would be important for us to know, and we
Yes,
could,
Exactly. Or
I would
which-
love to know.
Or what shoe you want to be.
Or Tara really wants to know what kind of shoe you'd be. So if you could
All
just
is relevant. You brought up the shoe thing. This is your fault. The end.
This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.